One of the key success factors for Scotland's implementation of integrated care is that there's been very strong engagement and involvement from the outset, both at top-down levels, at government and national government and local government levels. There's been cross-party and cross-government consensus on the need to do something different, because with the reality of the economic pressures on the ageing population, everyone realised that more of the same would not do. And as well as the top-down support and leadership for change, there was very strong engagement with clinicians, with social care professionals, and with community organisations that change was needed, and reassurance that change would not be imposed but would be co-designed with professionals and people living with need for care and support. So I think involvement and co-design were strong success factors. So Scotland has taken forward legislation to mandate the integration of health and social care at local levels. That's not absolutely essential and may not be essential in every system. However, we had had more than a decade of voluntary collaboration, and we had gone so far with that, and there was a realisation that formally integrating structures with integrated governance, accountability and single budgeting was going to give it more traction and allow us to make further progress over a shorter time scale. However, legislation on its own is not enough, and it needs to be only one of very many levers that you pull in order to drive change. Other levers being contractual levers for professional contracts, education and training at all levels, and really importantly, leadership and workforce development around integrated practice. Introducing new arrangements for integrated governance and accountability and joint budgeting was really important, because for over a decade we had been talking about collaboration and we had been informally collaborating across health and social care and with community partners. But to give it real teeth and traction, there was a further step required to mandate working together. Voluntary collaboration had been tried for some time, but this time there was an expectation and a need for reporting progress on more formal integration of structures, governance and funding arrangements. Scotland has an ambitious digital health and care strategy and an aspiration that citizens have greater control over their health and care records, and that they are supported also with the use of everyday technologies to access health and social care support, information and advice, and equipment and technologies to enable independent living. There's a very big programme of technology-enabled care that is supporting local health and social care providers to understand the possibilities of technology to enable care and to support them to introduce not just the kit, but to introduce new ways of working. We're very fortunate that for many years we've had a single electronic identifier for our community health records, so a community health index which tracks the health information across primary and community and hospital services. So we've got good joined up health data, and what we've been doing is linking that community health index identifier with our social care data in order to be able to track health and social care utilisation. There's a lot of effort being put into information governance arrangements and protocols for information sharing across the statutory providers, our health and social care providers, but we need to recognise that about 80% of social care is being delivered by non-statutory organisations, by voluntary sector and independent providers. So there's much more work to be done to get that information governance assured and routinely shared information across the full spectrum of health and social care providers. The personalisation agenda, or person-centred or patient-centred care as it's described in healthcare, has been around for a long time. I can think back to 20 years ago when we were beginning to talk about having patients at the centre of our healthcare systems, and indeed social care professionals have for very many years had a strong sense of personalisation to drive social care. So person-centred approaches were not new. What was different was formalising the way we engaged with people who have lived experience of receiving health and social care. And there was an expectation that they would be involved in the design of new models of care, would be involved in decision making at a local level, and would be involved in some of the national engagement. One of the mechanisms that helped that was the establishment of a body, an organisation called the Health and Social Care Alliance, which was an umbrella organisation that brought together the voices of very many charities who represent health and social care providers and people living with long-term conditions with chronic disease. So that acted as a real voice, amplified the voices of lived experience, and gave a really good entry point for engaging with that sector in the design of services. Whenever anyone asks about the impact we've achieved, it's tempting to say quickly we've not achieved enough impact and we're still trying to continually reform. But when you look back at the data and think about where we might have been, we can actually track some really significant progress. So every day in Scotland there's 10,000 more older people in their own homes, in their own beds, rather than in hospital beds or care home beds, than would have been expected had we continued to utilise health and social care services in the way that we used to. That's an observable fact. But the challenge is you don't see the people that are not there. You see the people that are in front of you. So we tend to focus, and media in particular tends to focus not on the successes, but on the challenges that still remain, particularly challenges of people who are waiting in hospital to go home because of a lack of a social care support package. So we see them, we know that 3 to 4% of hospital beds are being occupied by those individuals. So we focus on that, but we forget sometimes about the successes of the people who are not there because they're being supported to live at home. I think there's a lot of transferable lessons between Scotland and the journey that Catalonia is on at the moment, not least that it's a long journey. It's not one that can be done in 1 to 3 years. It's a journey that will take 5 to 10 years to really transform your system, because legislation and contractual levers are not enough. You need to change hearts and minds and practice, and that takes time. So one of the lessons is stick with it, don't give up, and give yourself enough time to actually realise the benefits. Another important lesson is to develop your workforce capacity capability together. Train together. Interprofessional education is really important, and support your workforce to understand what different disciplines do, indeed what different sectors do. Get them to learn together and that helps people to find new ways of working together.